Now to a big I-Team investigation.
2 children in the hospital for weeks after being poisoned.
Now the family says the system failed those kids. They talked to investigative reporter Terry.
Carol and Mike, so many people are wondering how and why a mother would intentionally hurt her children. This case, in this case, the mother's family and friends tell me there were signs she was slowly slipping away from reality.
Fallon Thomas.
You are looking at a mother in custody. Fallon Thomas is charged with attempted murder. She faces 60 years in prison if found guilty of poisoning Corleone and Andrew, her 5- and 8-year-old sons.
She had to have blacked out or, something was going on.
Family and friends tell the I-Team the problem started 2 years ago when Thomas was abducted and later found unconscious in a Chicago alley. When Thomas awoke, she didn't even know her own name. Doctors ordered her to start therapy.
A little bit of my understanding of this is there may be some severe post-traumatic stress. And, sometimes that can seem as schizophrenia.
In March, investigators say Thomas intentionally mixed her prescription pills and tea, then forced her sons to drink it. Those pills are used to treat bipolar disorder and schizophrenia, and the side effects are very serious. The boys spent weeks in the ICU.
I just know it wasn't the Fallon that I knew.
Kia Davis is a close friend and once lived with Thomas and her children. She tells me something didn't seem right when Thomas appeared in court.
She looked like she could be in her right mind, but she looked like she was scared and like she didn't know what was happening.
Thomas did plead not guilty by reason of mental disease.
We tried to tell them that she wasn't sane.
The aunt of the youngest boy says she first contacted the Department of Children and Families in November of last year. She tells us DCF did one home visit before the start of this year and found nothing alarming.
Can y'all just keep checking on my nephew to make sure that he's okay? And they didn't, and that's why we're here today.
The aunt says Thomas kept them from seeing the boys, and for 3 months she continued to ask DCF to do checkups at this apartment. The family told the I-Team the mother also received treatment here at the Milwaukee County Mental Health Complex. So, if the family made DCF aware of the mother's issues and she saw a therapist, it begs the question, did either agency ever compare notes about this family? We don't know because both agencies say federal privacy laws and confidentiality issues prevent them from discussing anything about this case. It's the same problem many families of patients run into, according to Peter Hoffa with the National Alliance on Mental Illness.
We get the complaint a lot from family members that they're told, we can't talk to you. And that's just not true. They can talk to them.
Hoffa waits on specifics of this case, but adds if mistakes were made, we have to learn from them.
I think out of fear and, whether it's lawsuits or blame, too much of our systems are afraid to be honest about where there's pitfalls and where there needs to be fixes.
But Joyce Felker with the Parenting Network says, let's give the agencies the benefit of the doubt.
I will tell you, I work with those folks from the system, from the Bureau. They are good people, and they really have a good heart, and they want to help. And sometimes it's a matter of, capacity.
Now, we should note, just because a parent suffers from mental illness, that's not reason enough to remove the kids from the home.
Still such a sad story. What about the boys, How are they doing?
Carol, I've been able to determine that the boys are out of ICU and they are in fact doing better, but the fact is they are now in foster care.
Well, at least they're better. Thank you,